Good morning, everyone. Today we are going to discuss a disorder or disease or space infection called Ludwig's angina. Angina by itself means strangulation, and Ludwig's is the guy who had coined the term and discovered the infection. He was a German physician, and this disease was first termed in 1836. Now, what exactly is this disease? It is a very aggressive type of space infection which spreads very rapidly, and it involves bilaterally both the submandibular spaces and submaxillary spaces, as you can see in the figure. It includes the area above the mylohyoid as well as below the mylohyoid, and it involves bilaterally, sublingually, and submental space infection. Now, what makes this disease dangerous is that it makes death is not due to the disease by itself but by the obstruction of the airway. Symptoms of Ludwig's angina: there is pain or tenderness in the floor of the mouth, which is underneath the tongue. There is difficulty in swallowing, drooling, problem with speech. There's called what is called as a hot potato speech, redness of the neck and swelling of the neck, which is often termed as a bull neck appearance, earache, fatigueness, tongue swelling that causes the floor of the tongue gets swollen, pushing the tongue towards the palate, fever, chill, confusion. Now, what are the causes? Causes of the most common causes, which almost involves all of the Ludwig's angina infection, is odontogenic infection of the tooth, especially around the second and third molar is the one which is most notorious for this type of infection. The others may be malignant injuries to the floor of the mouth. Patient with systemic illness such as the diabetic mellitus, malnutrition, compromised immune system, and other organ transplant, etc., are also very vulnerable to this type of disorders. Microorganism, they include streptococci, staphylococci, peptostreptococci, and fusobacterium, etc. It's basically a mixed type of infection. Management. Now, what happens is due to the swelling, it might be very difficult to intubate. So, airway is the main key. Management of airway plays the main role. Cricothyroidomy and tracheostomy is often required. Antibiotic therapy, which is given, is usually a broad spectrum antibiotic along with a anaerobic effective antibiotic like metrogel, and usually the dosage is given parenterally, so as after 48 hours of the effectivity of these drugs only it is shifted to oral.
Investigation. A dental X-ray, a CT scan of the neck with contrast material is used to identify deep neck space infections. If there is a suspicion of infection of the chest cavity, okay.
Chest can sometimes be done. Treatment modality involves incision and drainage. The incision resists the temptation to put the incision in the most dependent space. Now, incision should be done even if abscess is not expected. This is the reason for this is that we want to do a decompression. By doing so, the blood supply to these areas and antibiotic delivery is improved, and dissemination of the tissue is more unlikely. Now, if you can see clearly that after the incision is done, dissection is carried out till the mylohyoid muscle so as the submaxillary spaces is also drained, and a drain is placed bilaterally from one end to the other. Submandibular space infections or any other space infection can lead to various complications. One of the most very different or rare complication, necrotizing fasciitis. Whereas there is breachment of the skin, it is mostly seen in patients who are medically compromised. The dishwater appearance, and it was initially termed as hospital gangrene. Thank you.